fiber. Yeah.
Yes.
Hey guys, we're here live again at BC Laser. Today we're talking about Fraxel. We have Dr. Shaw, Jazz, and Ray here, who's getting a treatment on his hands.
Hi guys. Thanks very much for tuning in. Make sure you like us on our Facebook page or our YouTube channel. We're going to talk about Fraxels, and what you've probably heard is we've always talked about Fraxel for the face, but people just don't talk about using Fraxel for the off-face areas. So today we've decided to treat hands. People come in complaining of sun damage on the hands, and people have brown marks, and maybe we can come in closer and look at the brown marks here. So you can see the brown marks, and there.
Dr. Shaw, what's shiny on him?
Yes, that's just a bit of numbing, okay? And we're gonna take that off. Jazz will take it off actually, and then what we do is we treat the area, and this is usually for most people it's a one-off treatment, and then the sun damage still unfortunately will come through, so most people come and do a maintenance once a year. Just to begin with, I want to show everyone the machine. Fraxel is in fact a brand name for a particular laser resurfacing machine. A lot of people say they've had Fraxels, but in fact they've had other copycat treatments. And the Fraxel machine says Fraxel. This particular one is the dual. There are two wavelengths on there. And the one we're going to use today is the 1927 to particularly help with the brown spots on the ray here, and that will help with the brown spots, the very fine lines, and the pores and the texture. So that's the goal today. Jazz is just going to put special gel on the hand that allows the laser to glide over and treat the hands here. So there are two fibers. There's a 1550 and the 1927. The 1550, we're not going to use that today, but what it does is allows us to get rid of any superficial scarring, improve texture, pores, tightens up the skin a little bit, and this particular one, the 1927, also gets rid of actinic keratoses, or those superficial pre-cancers, pre-sun damage areas. So we're gonna start.
So Dr. Shaw, what's the difference between a Fraxel and a fractionated CO2?
Okay, fractionated CO2 is quite an aggressive treatment. We don't need to get that aggressive here on Ray's hands. We could do it if he had a lot of wrinkling, but we tend to generally do that for a lot of scarring and people who need severe or aggressive rejuvenation of the face. We use a fractionated carbon dioxide machine in the office here. This is a fractionated machine as well, and what it really means is that not the whole skin gets treated. What happens is it's like we are aerating the lawn, and we're poking little holes into the skin and causing mild damage to cause the skin to regenerate. So in Ray's case, we'll probably be treating about 40% of the skin. And you'll see, I'll treat the whole skin, but the laser will only be active on the 40% of the skin.
Ray, how you feeling?
Oh, pretty good. Looking forward to it.
Not nervous?
No, not yet.
Not yet.
Turn this in.
Yeah. So you can see that's the laser handpiece. There's cold air coming out through here, and you can see the ray will be on ray. Sorry.
Okay, that was an attempt at humor, Dr. Shaw.
Ba-dum-bum.
A little pun.
Yes, sorry. We'll have that over, and we're just gonna just wait. I need my phone.
Safety first.
Yes. So, we're ready. So we're going to start the treatment here, and we're just going to getting closer so you can see.
Okay.
So, you can see I've done one, then we're going to do another one.
How's that feel, Ray?
Don't really feel much of anything. Maybe like somebody dragging a fingernail across the back of your hand.
I'm just going to go a little closer here. Robin's saying she needs this.
Yeah.
How does it feel, Ray?
It's just lightly like a light scratching,
Okay.
like a fingernail going across the back of your hand.
So you can see it's just getting a little, just a hint reddish, nothing too dramatic. And I'm just gonna go over it again.
So Ray here is getting a treatment for his hands, but for all of us women that want to maybe keep our skin really clean, is this something that you would recommend once a year?
Yes, the Fraxel has, you can do it once a year. Often people with severe damage will often do, say, 5 treatments, one after the other every month, and then we'll end up doing a treatment once a year, just to maintain the results.
Okay.
We're experts in dealing with combination treatments, so usually for sun damage, what we would do is we would remove the sun damage and then go on a maintenance program to keep the damage away as much as we can, so that, you know, once you've gone through the effort of removing and rejuvenating your skin, you want to keep the results. So for Ray here, for example, we would be obsessive about sun protection.
Okay, so this is the second time you're going over the skin?
Yes, we generally will go over the skin about 4 times, perhaps even 8 times. But in Ray's case, we'll do this probably about 8 times. And if you have a closer look, you'll see the brown spots will actually, as time goes, will actually get darker over the next 3-4 days, and so they will flake off. How are you feeling?
Good.
Yeah?
Yeah.
Are you feeling more of it now, or?
About the same.
Yeah.
When you stop moving the laser, the hand feels a bit itchy, but that's about it.
Yeah.
What kind of aftercare do you need for this?
We use an anti-inflammatory topical regime, and we insist on lots of sun protection. But basically, you can go back to doing all your regular activities, work, everything.
And then over the next 3 to 5 days, you will see what on the hands? Will
You'll
there
see
be
the
some
dark
flaking?
pigment will start getting darker, and it will start peeling off. It will start getting a little flaky, a little dry, a little reddish, and you'll in fact see that fairly quickly. In fact, if you compare the two hands, you can see this one's already a little on
Can you
the
lift them up a little bit, Ray?
reddish.
Nice.
Pretty cool.
Yeah. So I've done 4 on this side, so we'll come back there and let it cool down, and we'll go on there.
If you have sunspots on the chest, will this help?
Yes, it will. In fact, we use Fraxel the most on the face. We use it on the neck and the chest, but increasingly we're doing hands as well. We've also been doing quite a few removal of sun damage on the shoulders. People who have, and on the upper arms as well.
And Gail's asking, will it tighten?
Yes, on the face it definitely will tighten, and it will.
How about the chest?
It really depends. In the chest, what we tend to do is we combine that with injections of collagen stimulator, like Sculptra or Belfil or Juvederm, and combine that to get rid of all the chest lines. Because
So
the
it really
combination
depends how deep the lines are.
Yes, it does.
I hope that answers your question, Gail.
Someone's asking Dr. Shaw, what is the downtime for this treatment?
Well, really, there is. You'll be a bit red for about a couple of days, and most people don't regard that as downtime. But you can put makeup on straight away as soon as you've done the treatment.
Any kind of makeup?
Any kind of makeup, and I think we'll be putting makeup on Ray, won't we? Yes.
The mineral makeup
Yes.
generally, though. So whilst Ray's getting his treatment, we're going to go off of Facebook Live, but
And
you can
Instagram
watch
Live.
us again. We'll be on our YouTube channel down the road here within the next week or so, and Ray's continuing to get his treatment, and look for that later on.
Say bye, everyone.
Bye.